All right. Hey everyone, Dr. Tam and Rocky here again. I'm excited about today's topic on spinal decompression. There's been some questions on what it does, where it comes from, Let's get started. What are people asking us via email and also some of the comments online?
Right. So spinal decompression is basically known for, relieving pain, back pain, basically, right? But a lot of our patients or our viewers are actually asking, how does it really work? What is it? What am I supposed to expect when I do spinal decompression?
So first off, spinal decompression, not only does it work for the back, but also works great for the neck as well. And when people ask, well, what is it really? The beginning of spinal decompression, to give you a little history, actually was invented by a doctor in Canada. And when in the early 90s, they first brought it over to the US, it was documented to be able to help a lot of people with delaying or avoiding surgeries. It was documented that in MRI, where the disc actually gets literally sucked back in into the spine after a disc actually bulges out, right? So if you look at a disc bulge, it's bulging out into the space where it's not supposed to be. Well, that's because it's getting compressed. But with spinal decompression, it's able to get the disc back in. But this doctor initially, because it was able to show that it can help avoid surgery, the medical community, a lot of surgeons actually did not want spinal decompression technology to come into the US. A group of doctors got together, and some sources will tell you they spent $500,000. Some sources will tell you they spent over $1 million in court in legal fees to fight to make sure that spinal decompression is a technology that can be delivered here into the US. And that happened in the 90s, right? So if you think about, let's just say even number $1 million that they spent back then, with time, that's compared to probably $3 to $5 million today that they spent to get that technology in here. And that's why when spinal decompression, we first learned about it in school, oh my gosh, life changing. And when we started doing it in our office and seeing patients' results over the last few years, I mean, it was undeniably one of the best things that can produce amazing, amazing results.
Mhm. Right. Yeah, and a lot of our viewers actually can testify to how it helped them um, manage their pain better, if not improve their conditions, right? Now, one other tool that's being brought up when it comes to spinal decompression is the inversion table or the inversion therapy, right? So, how is our decompression different from the inversion table?
So if you take a look at a video of our spinal decompression therapy tables, you're laying flat, right? You're not laying inverted. Here's the problem. With a inverted table where your head ends up here and your feet is here, but you're strapped at the ankle. The problem with that is the moment you start going upside down, you start getting blood rushing to your head. And there's a potential possibility that if there were, you have a chance of a stroke because of that intra increase pressure, right? The increase in pressure. If something bursts or if something were to happen, people will end up with getting a stroke. What's the first sign of a stroke? Just like a heart attack. It's a heart attack or a stroke, right? That's the first sign of a stroke
Mhm.
is a stroke.
Right.
So if you're hanging upside down, you're strapped in, and all of a sudden you have a stroke, who's going to be there to save you? No
No.
one, right? It's it's
Right,
almost
right.
over, right? So
Mm-hmm.
there's
Mm-hmm.
definitely um, a problem with that, you know, and it increased the chance of a stroke. But secondly, because a lot of people also come off the spinal decompression tables when they're inverted, their eyes are like bloodshot because the tiny capillaries in the eye
Wow.
starts to burst. Too much pressure. Okay.
Yeah.
Another thing is we've had two machines inversion tables where people came in afterwards. They weren't patients before, but they used the inversion tables, and we have two patients where it collapsed on them. Okay. The table
Wow.
malfunctioned.
Hmm.
One fractured T12 in the mid back between the shoulder blades. One fractured their T4, which is in their upper back. See? So
Hmm.
just
Yeah.
those problems alone and those side effects alone is enough for us to say, let's not do it. But they're marketed everywhere. I
Hmm.
mean, they're sold at all the major
Yeah.
stores, right? You got videos
Hmm.
online of people telling them how great they are. Well, what you don't see
Hmm.
is the people
Yeah.
who didn't get a chance to tell you what happened to them after due to a mistake.
After you. Right. And there's different opinions or feelings towards using the inversion table as well. Some even say that, oh, chiropractors just, recommend or recommend this the spinal decompression instead of the inversion table because they're gonna lose money, right? If so, that's something that was brought. I think that was one of the comments as well on our videos that
Absolutely. Hey, you know what? A chiropractor is just trying to recommend spinal decompression because they will lose money. That's partially true, but here's the thing: no doctor is a doctor usually just for the money. They really want to be there to help people, right? See, so if we see a danger in someone using a spinal decompression table, are we going to tell you to say not use it? Yeah, because there's actual danger behind it. And to really decompress the disc, they've done so many studies. Number one, the discs have to be pumped, okay, in order for it to decompress. And it's not so much on how hard it decompresses at the beginning, is how slowly the release of that pressure happens at the end. See, think of this. If you take a spring, right? You can pull the spring real hard, but what happens if you just release it at the end? Boom, that spring collapses. So in spinal decompression, if you just go from here and then boom, you come straight back up, it doesn't work. The other thing is the reason why it has to be pumped, right? Unless if you can do exactly the pressure where you're like teeter tottering back and forth all the time, you don't know. You don't know how long it takes. Think of a sponge. If you take a sponge that's been dry for a long time, you left it at your sink, it's been a couple of days, so it's like hard like a rock, right? If you put that sponge underwater, it doesn't absorb water right away. You have to squeeze it. You got to get blood flow to it, right? So you got to get blood flow to your disc in order for your disc to start absorbing. You can't just leave it underwater. Water flows right through the sponge, right? Same idea. Same idea.
Okay, and we also heard that spinal decompression has something or can benefit us when it comes to anti-aging. Is that correct or is that true?
Gravity is it's the biggest pressure on our body. Gravity ages us, right? There's no doubt. And it's inevitable. As long as you're living on earth, okay? You're going to have gravity, all right? So, because you have gravity, it's constantly pulling you down and it's compressing your spine. So, if you're not building up the muscles to protect it, if you're not getting decompressed, right? Well, what's going to happen is your body will start collapsing and starts to collapse over time. And that's where you start seeing people hunching over, in the lower back and in the neck over time. You see, that's why every week I hop on that spinal decompression. Every week I get adjusted. Every week I get decompressed. And people will ask me, well, Dr. Tim, you get it too? I said, of course. I want to get to enjoy the same benefits that you are enjoying as well. right? Yeah. When people ask me this question, Rocky, hey, Dr. Tim, you ever thought about retiring? I don't know. I don't know why people ask me this because I'm only 40, right? People ask me, oh, you've worked a lot. You ever slow down? I said, no, I don't want to slow down. I said, I'm barely just getting started. 13 years into practice, going into 14 years, right? But retirement for me, it's like stop doing everything that you do. What are you going to do? Just go sit on the beach somewhere? You know how long that's going to last for me? That's like the worst thing for me, actually, is actually sitting somewhere and doing nothing. I bet my patients, some of our patients probably know this about me. Like I can't stop moving, but you probably see me always doing things, going places, right? If I sit there and doing nothing, oh my God, that's worse than jail. Forget it. Life is over when that happens for me.
And so speaking of spinal decompression, Dr. Tam, is there a way for me to do it at home? Like, is there a way for me to avoid going to, to the clinic, to a machine, and maybe not avoid, but, I'll do it at
Well,
home?
here's the thing. It's you can do exercises like stretches that loosens up the muscles, right? You can maybe lean over a counter, grab the end of it, and then hang there for a little bit. You're going to alleviate some of the symptom, but you're not going to be able to achieve true spinal decompression. That's why I hop on that table. If I knew there was a way, like some people would strap a weight on their waist and then they just hang thinking that it will open it up, but it's not because you're getting constant pressure. You're not getting that pumping action. That pumping action is what's going to keep the disc open and closing. That's how you get fluid in there. See? So can you do it? I don't know. Maybe there's an apparatus somewhere that I don't know about. If I find it, I'll let you know. Right? The only other way is to buy a decompression table, but then you have to be a doctor to buy one, and then you have to train somebody to really strap you on correctly. And that's I don't know. I haven't done it yet. I'll tell you this: if I found a way already, I would have a table at home, but I don't have one. You know, so once I find one, we'll figure that one out.
Okay, well, thank you so much, Dr. Tam, for sharing your insights about, spinal decompression. And for our viewers, if you are interested, we're going to go ahead and put a link below on how you can, visit the clinic or get an appointment with us so that you too can experience the benefits of spinal decompression. Thank you, Dr. Tam.